I've so enjoyed my visits with Dr. John Jarstad, who is used to come in more regularly than we've had you, but I think you could travel a lot.
That's right.
It's good to see you again. How are you?
Thanks. Great, David.
You know, first of all, one of the things I remember, and this is kind of on a sad note, I mean, you used to work in the Northwest. Were you in Seattle?
Right. Yeah.
I think about that crane collapse in Seattle, and you probably can picture where that was and know exactly what was going on there.
Yeah, that's it's a sad thing, and those things happen, and sometimes it affects patients that you know and that sort of thing.
Well, let's talk about a couple of things we talk about. It just so happens I'm going to go see my my optometrist today, so this is kind of good to have the conversation with you. The as people age, I think we are more apt to have certain things that we remember hearing maybe our grandparents and our parents talk about, and then all of a sudden we hear the optometrist or ophthalmologist saying, well, you know what, this we see some of this in you also. What goes along with aging and our eyes?
Sure. There's several things. Probably the most common thing is just dry eye. The tear gland reaches its maximum potential about age 12, and then it goes downhill about 1% a year after that. So by the time people reach their late 30s, early 40s, they start to produce fewer tears, and that's the need for supplemental artificial tears and that sort of thing. So there's several really good treatments for that nowadays. We have both the over-the-counter eye drops, and then there's prescription items, mild steroids, and then there's a drop called Restasis that helps to improve the tear film. And then there are now tear implants that we can put in the tear ducts to help prevent the loss of tearing. So that's one of the more common things.
When you move, before you move on to the other ones, let me ask you about that. Would I know enough just myself to say I'll start using these eye drops, or should I get the professional's opinion?
No, I think that's something that you can tell just by the symptoms. Like if you're doing a lot of reading or computer work like you do, you're going to find that your eyes feel tired, or you feel like your eyes are a little dry. And over-the-counter drops are fine for that to start out with. We usually recommend them between 2 and 4 times a day. You can use them every hour if you want to, if you're doing a lot of work on the computer. And they actually did a study with college students around finals week, and found that those who used artificial tears got higher grades. So I guess they can study longer if they use those.
One of the things that I've noticed, and I just started paying attention to this within the last couple of weeks, is I don't think I blink very much sometimes when I'm reading. It could be off of a screen, or it could be articles or a magazine or a book. And I've started to tell myself to blink more, because blinking really does clear things up, it seems to me.
It does, and that's one of the things that we find is that you can suppress your blink reflex. The normal blink reflex is about 60 times a minute. Mm-hmm. And if you're concentrating on reading or computer work, or in a movie theater or watching television, you tend not to blink as much. You tend to suppress that with the brain.
So dry eyes or tear ducts not doing what they did when you were 12 years old, that's one thing. What else?
Right. And then cataracts are probably the most common thing in the United States. It's certainly the most common operation done in the world now, and we certainly see that here. Our average age of a cataract patient that has surgery or that needs surgery is 74 here in Columbia, and that's a fairly common age throughout the U.S. So that can happen, though, earlier if a patient's diabetic or if they spend a lot of time out in the sun. Longshoremen on the East Coast, they tend to get cataracts sooner than most people. So it's a good idea to protect your eyes against the ultraviolet effects of the sun that can accelerate cataracts. And so that's a fairly common thing. Now, if somebody's worn glasses their whole life, this is an exciting thing for them, because we take a cataract out, and nowadays we put in a prescription artificial lens that can correct them just like a LASIK surgery would.
So really, you wouldn't have to have the glasses anymore after that.
Right.
So how do I know if I'm starting to have cataracts?
That's a good question. The most common symptom is people notice driving at night. They're affected by the glare from the oncoming car headlights, and they see glare and halos and sometimes starbursts as the car approaches them. And so that's the real tip-off. And if somebody's over 50 and they see that, then they should go in and see their eye doctor.
All right, those are cataracts. What else? I don't like going beyond that, but I suppose there are other things that we need to talk about.
Yeah, probably the other thing that's fairly common, there's glaucoma, which increases with age. 3% of patients have it at age 30 and about 25% at age 80. So it goes up precipitously older patients. But the more common thing than that is macular degeneration. And for the longest time, we thought that was an inherited condition. And that's what I was taught when I was in training at Mayo Clinic, is that that was something that you inherited from your parents. Well, there was a colleague of mine, Joanna Seddon at Harvard, who noticed in an identical twin study, these are identical twins that were separated at birth, and they had 60 of those. And then they reviewed their health 60 years later. And they found that one identical twin had macular degeneration, the other didn't. Now, identical twins are exact copies of each other. There's no genetic difference. And so they realized that that couldn't be inherited then, so they started looking at the environmental factors. And every single one of the ones that had macular degeneration had parents that smoked in the house when they were young. And so I thought, gosh, that's crazy. I don't believe it. So I started asking my patients when I newly diagnosed them with macular degeneration, did either of your parents smoke in the house when you were growing up? And for an entire year, every single patient said, yeah, my parents smoked, or my dad was a chain smoker in the house when I was young, and typically before age 15. So patients would always say, well, if I smoke, it's only hurting myself. Well, not necessarily so anymore. So anyone that's got kids, they should not smoke in the house, or grandparents should make sure the kids are not exposed to that.
Well, if you would ask me that question, then if I'm seeing you, my answer would be yes also. So
Yeah.
I don't like hearing that.
So there's one thing, though, that can be done to prevent the consequences of that, and they found that they studied all sorts of vitamins and things, and they found that lately that vitamin D in 5,000 international units a day will prevent that from happening if you're over 50 and you take that. So if your parents did smoke in the house when you were young, you should take vitamin D supplements, 5,000 international units a day to prevent it.
So that would be beyond the vitamin D that I get by being outside?
Yeah, that seems to be the case.
I have to look into that. Caller, did you have a question for Dr. Jarstad?
Yeah, could you tell me how the research is going on repairing damaged optic nerves?
Sure. Yeah, that's a good question, and that's an area that I was at a seminar a few years ago, and the head of the NIH, which is the organization in the United States that provides the funding for eye research, they said that over the past decades, most of the research was focused on cancer and AIDS research, and he said, the head of the NIH said, for the next decade or two, we're going to be concentrating on eye research, and particularly regenerative medicine, which is the answer to that caller's question, is that they will be able to use stem cells grown from your own body and manipulated so that they can replace the damaged optic nerve and the damaged retina. Now, they're starting to do those studies now with human patients, but they have not gone to the optic nerve yet. That's the next step. Right now, they can transplant retina, which we never thought would be possible, and it's taking, and that looks promising. The reason it's so slow, and I wanted to find this out because I'm impatient. I like to get results right now. And my colleagues that are in the research area say, well, we have to have a sufficient amount of time to make sure that these new techniques and stem cells and things don't turn into an eye cancer or something when they're transplanted. So that's the reason for the wait. They have a very small number of patients that they're studying, but so far, so good. So I think it's on the horizon, and I think in that caller's lifetime, they'll probably see an answer to that.
That would be good news. I know exactly why that would be good news for him, I believe. Anything else you want to tell us as far as keeping our eye health as the best that we can possibly do?
Yeah, that's great. One of the things that's come out of recent research is the use of sunglasses that are the wraparound type. They didn't realize how important it was to protect from the sides. And so the Terminator style glasses, sunglasses, or glasses with some side protection, that's been really found to be critical in preventing growths and tumors on the eye. And I was just in Honduras last month, and a lot of the patients there don't wear sunglasses. And the same in the Philippines. When I was there last year, they said that I said, why don't patients use sunglasses here? And they said, well, sunglasses make people look shady, like they're dishonest, so we don't wear them. And so I thought, oh my gosh, they're getting these eye conditions that could be prevented with just the proper use of sunglasses.
Interesting, because I was just thinking when you were saying using those sunglasses wraparound, I was going to make a flippant joke. So now you can wear them, not just because you look cool, but because
Right.
you also are trying to prevent eye problems.
Yeah.
Are we seeing as baby boomers age, are you seeing more of these eye conditions like cataracts and macular degeneration and glaucoma?
Yes, we are. And I went to a seminar that was conducted by our national association, and they listed all of the projections for the future and the need for eye surgeons and eye care providers in general. And the conclusion at the end was that we needed to train more eye surgeons. Well, then at the end of the seminar, the head of Medicare and our national organization were there, and they got together and huddled up, and they said, well, we've decided not to make any changes. So there's a shortage now of eye surgeons, and they're planning not to increase the number in the future. Now, some of the state schools and things, they have their right to make changes, and so, but they have to get approval for these residency programs through the national boards and things. And so University of Missouri, MU Healthcare, has added one position. So we now train 4 eye surgeons every year, and in the past decades, there were only 3. So there are some medical schools and programs that are, taking it upon themselves to really challenge that and add eye surgeons. And optometry has done a good job picking up the primary care needs of the population, and they are training more eye specialists. But as far as surgery goes, we're fairly busy now, and it's only going to get more busy in the future.
Is there a waiting list? People want to get into the field?
There is. Last year we had, I think it was 1,200 applicants for 440 positions, and the year before there were only 800 applicants. So it's a great specialty. It's talk about job security. It's only going to get more busy. And my daughter's an eye surgeon. She's a professor at Stanford. Just started there last year, teaching eye surgery, and she'll have a good future, I think.
So when you went to Honduras, did you go to small villages, or were you in a big, more populated urban area?
No, we were out in the jungle about an hour from civilization, and it was really interesting. We were among the cloud people near La Ceiba, which was the biggest nearby city, and it was about a 3-hour bus ride from San Pedro, and we went off into this village, and there was a beautiful setup there that this family had made this beautiful hacienda that was there, and they built 2 clinics. One was a dental and medical clinic, and then they asked me if I would give them some plans to create an eye clinic and surgery center. So I sketched something out and I sent it to them, and they actually built it exactly according to those specs. So it was really a great facility. We operated there. We did about 36 operations, and we took 2 of our senior residents who were very skilled at surgery, Ryan Mercer and Van Wynn, and they just had a ball. They enjoyed it. They even had a pet monkey at the place, which was entertaining.
How'd the people respond?
They were so gracious and so appreciative because when they told us to come the first time, they said, we have no medical care here at all. No one will come and help these people. And so it's called Proyecto Honduras, and it's a charitable organization. They do all of their donations for medical work. And the people were, so appreciative. As you can imagine, they had conditions that had been going on for years. There was a 24-year-old girl who had been blind from cataract since she was 14. And we operated on her and took the patch off the first day, and were wondering if she'd be able to see anything. And the monkey was kind of walking around over on the other side of the room. She goes, "Hey, there's a monkey." So everybody was pretty excited about that.
Well, I hope we can have you back sooner than what our last 2 visits were timed from. Always like to talk to you, and I know you bring some valuable insight information to our listeners. And so, Dr. Jarstad, we'll have you on again. Thank you.
Thanks for having me.
Dr. John Jarstad from MU Healthcare has been our guest. You're listening to News Talk 1400 KFRU.